Most people with arm pain, numbness, or tingling are being told to treat the wrong body part. They stretch the shoulder, massage the arm, and rest it when symptoms flare up. Sometimes it feels better briefly, then the pain, tingling, weakness, it comes right back. So in this video, I'm going to explain why symptoms you feel in your shoulder, your arm, or your hand often start in your neck, how to spot the clues most people miss, and how understanding this early can save you from chasing the wrong problem for months or even years I've seen. And stay with me to the end because I'll walk you through a simple neck movement check that helps you understand whether your symptoms may be coming from your neck rather than the arm itself, which is often the missing piece that keeps people stuck treating the wrong area. Hi, I'm Dr. Paul Barnwell, chiropractor in Katy, Texas. For more than 10 years, I've helped people get out of pain and return to the life that they want using natural care instead of drugs and surgery. My mission is to help people understand their bodies and build long-term health so they can live with confidence and purpose. If you're dealing with chronic pain, failed treatments, repeated flare-ups, or surgery being recommended without a real plan, this channel's for you. You deserve clear answers, not quick fixes. In this channel, you'll learn what is actually happening inside your body, what actually helps it heal, and the information most people never hear in a routine doctor's appointment. Subscribe if you want to understand your body better, reclaim your health, and get practical steps you can use right away to move forward or toward a life with less pain and more purpose. I upload a new video every week. In most cases, it comes down to gradual changes in the cervical spine that affect how much space those nerves have as they exit. Remember, those nerves leave the spine through very small openings on each side called the neuroforamen. That's just a little hole. There's not much room to spare, so even small changes can start to create pressure. One of the most common causes is degenerative spinal arthritis. Over time, the joints in your neck can stiffen and they develop bony spurs. When those spurs form near the neuroforamen, the small hole, they narrow the opening. That puts pressure on the spinal nerves traveling into the shoulder, the arm, and the hand. Another frequent cause is a cervical disc bulge or a disc protrusion. When a disc changes shape even slightly, it can put pressure directly on a nearby nerve. And here's the confusing part. The pressure may not feel like it's in the neck at all. Instead, it shows up as arm pain, numbness, tingling, weakness further down the line, because this is where the nerve travels. Posture also plays a big role in this, more than most people realize. Forward head posture, the kind that develops from sitting at a desk or looking at screens all day, places extra stress on the joints and nerves in your neck. Your head weighs about 10 to 12 pounds, and when it sits forward, then the shoulders start to round out for hours at a time. The nerves are under constant load. In some cases, the normal curve in the neck can even reverse into what's called a cervical kyphosis. And when that curve changes, it alters how the force is distributed through the spine, and that can add even more stress to the spinal nerves. What all these situations have in common is that they usually develop slowly. There is no single moment you can point to, no fall, no accident, sometimes. Just gradual wear and gradual postural stress. And because the irritation starts the neck, but the symptoms show up in the arm, most people never connect the two. They focus on the shoulder, the elbow, the wrist, completely unaware that the real issue may be sitting a few inches higher. When arm symptoms show up, the shoulder usually takes the blame. That makes sense at first because the shoulder feels tight, it feels sore, it feels restricted, knots form in the muscles, the traps in the shoulder blade area feel tense, movement can feel uncomfortable or limited, everything points to the shoulder as a problem. You ever felt like your shoulders are up here? But here's what's actually happening in many of these cases. When a spinal nerve is irritated at the neck, the muscles along that nerve pathway tighten up automatically. It's a protective response. Your body's trying to guard the area and create stability around the irritation that's up here. That muscle tension is not the original problem. It's the body's reaction to a problem. This is why so many people spend months stretching the shoulder, massaging the traps, or doing strengthening exercises and still feel stuck. The muscle tension might calm down for a day or two, but then it comes right back. And the reason it comes back is because the nerve irritation is still there. So the body recreates the same protective tension over and over. The shoulder is not being stubborn, It's doing what it's supposed to be doing. It's reacting to a signal coming from higher up. And until that connection is recognized, it's easy to keep chasing muscle pain, treating muscle tightness, and wondering why nothing ever fully resolves, why it doesn't stay away. That brings us to one of the most important clues that you can use to figure out whether your neck is actually involved or whether it is a shoulder. And this is something you can notice yourself right now. In a healthy situation, moving your neck should not send pain, tingling, or numbness into your shoulder, arm, or hand. You should be able to look up at the ceiling, you should be able to turn your head to check your blind spot, or to tilt your neck from side to side without feeling anything travel down into the arm. That's normal, but when the neck movement does change arm symptoms, that tells you something critical. If you're looking up increases arm pain, or if turning your head to one side causes tingling to shoot down into the fingers, it's not random. It means the nerve is being compressed or irritated closer to where it starts, which is at the neck. The movement is not creating a new problem, it's revealing pressure that's already there. This is also why arm symptoms can feel so unpredictable. One day your arm feels fine, the next day it's tingling or weak, and you have no idea why. What's often happening is that small changes in head position or posture or changing how much pressure is on the nerve, just a few millimeters of movement can be enough to affect how the arm feels. Once you start to notice this pattern, the confusion around your symptoms starts to make a lot more sense. And that's exactly what I want to help you do in the bonus section, because I'm going to walk you through a few simple awareness checks that can give you a much clearer picture of what's actually going on. Now, if you look here, so for one, if you're sitting in this position and it's causing it to get worse, then definitely it's coming from the neck. But this is really interesting here. But this is a pattern of where those nerves go. So you can see up here, this is C2, C3, C4, 5, 6, 7, 8, down to T1. So these are the representing the bones in the neck. And this shows where that distribution goes. So if you're feeling it in this part of your hand, if you're feeling it here, if you're getting headaches, it tells you where the problem may be along that pathway. So as you're going through this check and you're feeling it in certain areas, or if you're just sitting at a desk and you're starting to feel numbness or tingling here, or you feel pain in the back of the shoulder that goes down the arm, it's going to reveal exactly where that's coming from. Now, if you want to look this up, all you have to do is go to this, very small website called Google and type in dermatome map. That's dermatome map. That shows where those nerves are going, and it shows where it may be originating from up in the neck. What I want to do next is walk you through 3 simple awareness steps to help you better understand whether your arm symptoms may be coming from your neck or from the arm itself. This isn't meant to diagnose or replace the role of your primary healthcare provider. It's simply a way to make sense of what you're feeling. Always get a proper checkup with your doctor or chiropractor if symptoms are continuing or if they get worse, obviously. So first, pay attention to whether your arm symptoms change at all with different head positions or neck positions. So if you're turning your head to the side, if you're pushing it forward, bringing it back, even small changes matter. If sensation shifts, increases, or if it eases when the neck moves, that's an important clue. Second, notice if your symptoms move around. Pain that jumps from the neck to the shoulder, then from the shoulder into the arm or hand. It can be confusing. That movement does not automatically mean healing. It often means the irritation is changing location along that nerve pathway, just like you're seeing here. Third, be aware of a key red flag. If you're looking up or turning your head, if doing that causes pain, tingling, or numbness to travel down into the arm, that's not random. It can be a signal that the nerve space in the neck is being stressed. So these observations are not about fixing anything in the moment. They're about helping you stop guessing and start understanding the pattern behind your symptoms. So now you know that arm pain, numbness, and tingling don't always start in the arm. You understand why the neck is often the real source of those symptoms, even when the neck itself doesn't hurt. You also learn that the most common reasons nerves in the neck get irritated without a major injury: disc changes, spinal arthritis, forward head posture, and gradual stress over time. All of these can create nerve irritation that shows up as arm symptoms, which is why so many people end up treating the wrong area for months or even years. If you're dealing with any of these symptoms and they're not resolving on their own, consider getting a proper checkup with a chiropractor. Chiropractic care has helped thousands of people recover safely from shooting pain into the arm caused by neck issues, often without medications or surgery. Those things are just band-aids anyway. If this video gave you clarity or helps you make sense of what you've been feeling, do me a favor and like it so more people can find it. Share it with someone who keeps complaining about shoulder pain or arm numbness and tingling that won't go away. This might be exactly what they need to hear. If you have questions or want me to cover something specific, drop a comment below. I read them and they often turn into future videos. So if you want more content like this, content that helps you understand your body better, reclaim your health, and take practical steps towards a life with less pain and more purpose, hit subscribe. I put out a new video every week. And if you're ready to take the next step, I made a follow-up video where I walk you through the 7 best exercises to relieve neck and arm nerve pain. That's what you should watch next, and I'll see you there.